Hello everyone, my name is Leila P.L. Valete and I am the Health Education Manager here at AiArthritis, and I am here to report back from EULAR 2025 for our Go With Us program. And today I am going to be talking all about IgG4. And you may be thinking, why are you talking about IgG4? It's not an autoimmune, autoinflammatory arthritis disease. And one of the reasons why we are talking about IgG4 is because we have a project in the works, or actually the version 4 is actually out right now and you can look at it, of our mystery patient guide. And in order to create this mystery patient guide, we had to get funding for it. And Amgen Rare was wonderful enough to fund us for this project to have the mystery patient guide for us to be able to give guidance to those who are undiagnosed. And with that, put in IgG4 because IgG4 is actually commonly misdiagnosed as an AiArthritis disease like Sjögren's, lupus, sarcoidosis, rheumatoid arthritis, and another condition that it overlaps as well is cancer. And a lot of people, when they're first diagnosed, the doctors think that they have cancer. And so those are the reasons that we are talking about IgG4. And there's a lot of research going on for medication with IgG4. And thankfully, one of the medications that I'm going to talk about today, in the presentation, it said that there's no FDA approved medication, but that is outdated because one of the medications that I'll talk about is actually FDA approved. And that came just about 2 months ago. And so super exciting to talk about because although IgG4 is a very rare disease, it is very debilitating and there's a lot of organ damage and organ enlargement and all of those things that can happen to the pancreas, lungs, kidneys, salivary glands, all over the body. And so it's a very devastating disease. It causes a lot of fibrosis and inflammation. And so it's really great that they finally have an approved medication. And so the medications, there's a few different medications that we'll be talking about. And one of them is Inebilizumab, which is also Uplizna, which is Amgen's medication that just got approved by the FDA that I was just talking about. And this medication is a B-cell depleting therapy, which is a really common theme throughout EULAR this year. A lot of the medications for these diseases do have to do with B-cell depletion and B-cell inhibition and things like that. And so in the phase 3 trial, nearly 60% of patients taking this medication reached flare-free, steroid-free remission by week 52. And it significantly reduced flare risk, lowered steroid use, and helped maintain remission across all subgroups, regardless of sex, age, race, or region. It showed a strong safety profile with no safety concerns. And that is very specific because IgG4 is way more common in males than it is in females. But specifically for Asian females, it can be common. But for Black, white, Latino men, it's more common in men. It's very interesting how it affects the different races with this disease. And there's one more treatment that's also on the horizon, and that is called Ruznilomab. And it is a PD-1 blocker, and it's been tested in a phase 2 study so far. And after a short steroid taper, 70% of patients stayed flare-free for 1 year. This treatment was well tolerated with minimal side effects and shows promise for long-term disease control. And so always having different types of mechanisms to help with a specific disease is very helpful because not the same mechanism may help everybody, or the mechanism maybe doesn't work for you anymore after using it for a certain amount of period of time. So that's why it's super important to have variety in the different kinds of medications that are created for each disease. And another thing that they talked about was SACQ patients or SACQ patients. And that's it stands for serologically active, but clinically quiescent. And serologically active means lab tests, especially the levels of IgG4 are high. And clinically quiescent means you feel well with no symptoms or signs of active disease. And so they use that term to talk about patients that did not have higher relapse risk, and they were doing well just as long as steroids were tapered down slowly. And so it's really important for the doctors to remember to not treat the numbers, but treat the person. Just because IgG4 levels are high, it shouldn't dictate whether a treatment is stopped, started, or things like that. You really have to go through the symptoms that the patient is feeling. And that's what's really confusing also about IgG4 is you would think because of the name IgG4-related disease that the level of IgG4 in your blood serum is very important and like you're always going to have a high level of IgG4, but that's not necessarily what the case is. IgG4 is the high IgG4 in the blood is a result of the disease, not the cause of the issues of the disease, if that makes sense. It's very confusing. I even heard from one of our partners that some patients in the world are trying to push to change the name of IgG4-RD because they just feel like it doesn't really represent what the disease is. And I can totally understand that because of the misnomenclature of IgG4 makes you think that all people with IgG4 are always going to have high IgG4 levels, and that's what the disease is, and that's what causes all these symptoms. But it's actually the mechanisms inside the cell that are happening because of the disease, therefore raise the level of IgG4, and that's what doctors first found when they were looking at IgG4 patients, and that was the first pattern that they started to look at. So that's why they initially named it IgG4-RD. And a lot of the things that they look at are biopsies to confirm IgG4 as well. And this is called histology, when doctors examine tissue under a microscope for disease clues. And a Romanian study revealed that relying on histology alone led to misdiagnosis in 60% of suspected IgG4-RD related cases. And those patients were later found to have other conditions like lymphoma, sarcoidosis, or vasculitis. And diagnosis must be comprehensive, using symptoms, lab results, imaging, and histology together. So that's funny because it's like the opposite of what we were saying, that IgG4 patients usually get misdiagnosed with sarcoidosis or vasculitis or Sjögren's. And now they're saying that people who have lymphoma, sarcoidosis, or vasculitis are also getting misdiagnosed with IgG4 because of the IgG4 immunoglobulins showing up in the histology or in the microscopic pieces that they're looking at. So we do like to try and find ways to expedite diagnosis and finding the best ways to diagnose these diseases. But sometimes it really does take a comprehensive approach, like we said, of not only is it the lab results, the histology, the imaging, or the symptoms, it's all of them together to be able to make a very educated diagnosis. And lastly, why does this matter for patients? In Europe and the other parts of the world, there are not any approved treatments for IgG4. Both Inebilizumab and Ruznilomab may soon change that, and Inebilizumab is FDA approved in the US. Hopefully it can be approved in other countries to be able to help these patients. And also understanding conditions like the SACQ patients, it empowers both patients and providers to avoid unnecessary treatment and focus what on truly matters, how you function and feel. And again, I just said this in my last video that I made today, personalized treatment is such a huge theme this year at EULAR. And that is making sure that we are getting, we're hitting the guidelines that are set forth through ACR or EULAR when going through treatment. But you use those guidelines as a starting point, and then you figure out what's best for each patient at that time. And so that's what is so important about personalized medicine and personalized treatment, is that all of our diseases are heterogeneous. No disease case is exactly the same. So individualized treatment is so important. And lastly, raising awareness of diagnostic pitfalls helps to reduce time patients remain undiagnosed, especially those who fall under the mystery patient category. So all of the research that's presented with this just reiterates the need for guidance and for help for patients who are going through these symptoms and may have no idea what's going on. Leading them to the mystery patient guide can then therefore lead them to possible answers. And it's starting from somewhere. And that's what's super important and what we love to be able to provide to our community. And so with that being said, thank you again to Amgen Rare for sponsoring this track of Go With Us. We are so excited to be able to present all of these resources to our community and also be able to help those who may be misdiagnosed with IgG4 or vice versa. And that is about it. Thank you so much for listening to my debrief about IgG4. And yeah, let us know in the comments if you have any questions or any comments about this video. Talk to you later. Bye.